There is a stigma around STIs. Even with perfect hygiene, people are still getting UTIs, especially Black women have been subjected. They've been used, they've been studied, they've been cut open and experimented on without consent. Period pain is normal, but period pain that interferes with your daily life is not. What if the reason you haven't gotten answers isn't because your body is broken, but because the system was never built to listen to you? Welcome to G Chats. Hi guys, welcome to G Chats with your host Giana and we are back in the G spot. It has been a while since I filmed and I'm cheesing really hard. I'm super happy to be back. As many of you have known, we concluded season 1 in August of 2025. I did it for 8 months straight. We launched in January, did it all the way until August. I needed a little bit of a break because a lot of things for With Meraki Co. were happening. It was just a lot for me as the founder and the CEO to run everything and also do the podcast. So I needed a bit of a break and we said we were going to come back for season 2 and season 2 is here and I'm super excited. So today's episode is a Q&A and there's about 12-ish questions because some of them are pretty long questions and I just broke some of them up into multiple questions just so that I could make this video comprehensive. So we're starting off strong with people asking me, are UTIs really just a bladder issue or are we looking in the wrong place? When we talk about UTIs, yes, it's true. UTIs, they do happen in the bladder. Obviously, most urinary tract infections happen in the bladder. So many people don't realize the urinary tract is kind of 3 areas. It's your kidneys, your bladder, and then your urethra. Most UTIs that we recognize and see are cystitis, and they are taking place in the bladder. And so that's where we see most urinary tract infections. And that's meaningful. It tells us a lot. However, it is important to understand that there's a lot of research that talks about embedded UTIs, chronic UTIs, biofilms in the bladder. So the bladder is very important, such a super important organ that we need to hone in on when we are talking about urinary tract infections. But I don't think that it's the full story because when we are talking about UTIs, we kind of have to zoom out and think really hard about where is that bacteria coming from? Now, yes, certain infections will persist in the bladder because they never went away because of a biofilm, because of recurrence that exists, the embedded nature of some UTIs, which is research that's advancing in that space. So I don't want to ignore that or neglect that, but I do think we should come back to what is causing these UTIs to begin with, or where is the UTI bacteria coming from? And in most cases, what we understand is it's coming from the gut. So that's really important for us to kind of recognize and identify and approach, because if we just focus on eradicating the bacteria in the bladder, and even if the bladder is never being fully cured through the antibiotics because of a biofilm, because of an embedded infection, and let's say a solution comes out where that can be cleared. If you then do all of that work to clear the biofilm and the embedded infection, but you don't resolve the issue that exists in your gut that's allowing for the uropathogenic E. coli or your urinary tract bacteria to thrive in and be a reservoir in, then you're wasting your time, unfortunately. You're not really solving the problem. So I think that that's something that just really needs to be looked at because, yes, UTIs are a bladder infection, but recurrent UTIs are also often a microbiome plus an immune regulation issue and not just an isolated bladder problem. And that's why just repeating antibiotics for most cases don't always solve the recurrence pattern. So question number 2 was, why do women do everything right and still struggle with BV, yeast, or UTIs? So really, it boils down to the fact that when we say women are doing everything right, a lot of times that kind of groups together the hygiene, the post-sex care, and all of these things. And I've said it before and I'll say it again. BV, UTIs, yeast infections, they are rarely a hygiene or a sex issue. I know the society wants to pin it on sex. They want to pin it on hygiene. They're rarely a hygiene issue. A woman can pee after sex. She can wipe front to back, shower twice a day, use antibacterial soap, do all the things that TikTok's hygiene talk is going to tell her to do, everything that an ER doctor is going to ask her and double check that she's doing, and she's still going to get a UTI, a yeast infection, BV. And that is because they are so much more than our vaginas just being this like garbage can that you need to sterilize, disinfect, rinse out, and all of that. Like, you don't have to do all of those things. What you can do is do things that actually align with microbiology. So, of course, wear cotton underwear and avoid fragrances and things like that. And a lot of times, again, women are doing all those things and still struggle, but that is because the underlying layer, and what you can really do is look at these underlying layers. Things like hormonal shifts, chronic stress, immune dysregulation, gut dysbiosis, antibiotic history, partner microbiome contribution. All of these matter because recurrent infections are rarely about doing something wrong. You're not doing anything wrong. You're not wearing the right underwear or accidentally put perfume on and maybe that's all of a sudden triggering a yeast infection, or it's not that. You could use unscented soaps. You can shower twice a day. You can do those things. But again, if you're someone who sits in a bathing suit, and last season we did an episode about like summer hygiene and stuff like that, and I made a video and I discussed how if you sit in a bathing suit, a wet bathing suit, and then boom, you get a yeast infection, there's an underlying issue there. It's not about, oh, you sat in a wet bathing suit and that grows yeast. Like, yeast doesn't just grow in the vaginal canal like that. Like, sure, there's an environment that is favorable for yeast, but that means that there's an underlying colonization issue with the fungi, with the candida, that needs to be addressed. And it's not that you need to be afraid every time you go to the beach, right? It's the same with like sex, for example. Of course, peeing after sex is great practice, but it's not one of those things where if you forget, boom, a UTI happens, and then that kind of insinuates that your body fails you. And if you're never able to have access to a toilet because you did it maybe somewhere where there isn't an access to a bathroom, then you're doomed and you're going to get a UTI. That's not really the logic here that we should kind of frame or create, that if you don't do these things, you're destined for a urinary or vaginal infection. It doesn't work like that. They're good practices and things that we should do regularly. You should try to purchase cotton underwear and wear those regularly. You should try to pee after sex. You should try to shower every single day and make sure that you're cleansing properly with a nice gentle cleanser. You should avoid fragrances. You should avoid douching products. You should avoid these hygiene washes and feminine washes that have these fragrances and extracts that can irritate the vulvar region. So like, again, great practices, but those are not the full story. So really, if you're, for example, your yeast infection, if your yeast is persistent because of your insulin levels, you're pre-diabetic, or you are someone who struggles with diabetes, there's a link there that potentially that is why the yeast won't be eradicated so easily. And so in that situation, that is an underlying factor that needs to be addressed. Your insulin. Is your cortisol contributing to your insulin sensitivity, for example? Is your cortisol contributing to your estrogen being low, and that's contributing to your bacterial vaginosis? These are things that are important to understand, right? Even with noticing bacterial vaginosis or a UTI or a yeast infection around your period, it's not that you did something during your period. Oh, you went an extra hour without changing your pad, or you didn't cleanse properly. It could very well just be your hormones being an underlying factor that's not discussed enough. So these are just important things like immune dysregulation. If your immune system is weak, that can contribute to you struggling with recurring urinary and vaginal infections. So that's just kind of my expert opinion on why some women do everything right and still struggle with BV. And it's honestly because the everything right is always about hygiene and sex. And most women are following the typical practices that an ER doctor is going to tell her about, the internet's going to tell her about, and she's still having it, which all showcases how these things are not the core reason. Hygiene in sex is not the core reason why urinary and vaginal infections exist. They exist for many other reasons that are totally not related to hygiene or sex. Those are some things to keep in mind if you are someone who's struggling and feels like you're doing everything right. So question number 3 is a very trendy question. It says, do men contribute to recurring BV more than we would like to admit? So there is nuance to the answer. Yes, men can contribute, and we're going to talk about why. And I think it's really important, firstly, to just emphasize that people who have bacterial vaginosis can be celibate, can be in same-sex relationships, and can be in heterosexual relationships. So men are not the sole reason for BV, because we are literally, if we say that, we are eliminating lesbian women who are in relationships with other women and they're struggling with BV, and we're making it more difficult for them to come out and talk about these infections. Women who are celibate, who now feel like, oh, I can't speak about this because people are going to think I'm either dirty, I'm unhygienic, or I'm lying, I'm not actually celibate. So we just have to be careful, because men can contribute, but they're not the sole reason that BV exists. So the penile microbiome does exist, 100%. Is it fully mapped? Do we fully understand the penile microbiome as of today? No. Research is still advancing. We don't know fully what a healthy penile microbiome looks like, because it's very different than the vaginal microbiome. We have a canal that's inside of us that has moisture content, that has a specific temperature. Like it's hormonally responsive. Like our vaginal microbiome is intricate. The penile microbiome is external skin, right? Like the skin on our hand, the skin under our arms, our armpits, our groin area, our neck. The skin has a microbiome. So yes, does the penis have a microbiome? Yes. Does it function the same way the vaginal microbiome functions? No. And so can we definitively, concretely say men carry Gardnerella long enough to be able to insert it back into a woman? No. Do we know that it can be on their penises after they have share intimacy with someone who does have BV-associated bacteria in their vagina? Yes. Do we know exactly for how long? No. Most research identifies it as short-term. Like it will last for a day, maximum maybe 3 days, and it gets washed off, or it simply dies off because it doesn't have the right condition on the penis to thrive. So many people will assume that men will carry Gardnerella. And while yes, let's say if I spit on my hand and I shake someone else's hand, of course I'm introducing oral pathogens to their hand, of course. But will that linger long enough to where they can then in 5 days give that back to someone else or give it to someone? Probably not, because the skin microbiome is very different. It doesn't have the same temperature. It doesn't have the same moisture content. It doesn't have the environment that Gardnerella or anaerobic bacteria that is native to BV wants, like it does in the vagina. So we can't just say that men are carriers. Research has shown that they can, but that's simply microbiology. So I always push back on this, because microbiology shows us, like, if you kiss someone, you're swapping microbes. That's normal. Do those microbes stay in your mouth forever? I mean, that's oral to oral, but the penile microbiome is very different from the vaginal microbiome. So we can't just say that men are carriers. They of course, through microbiology, can have the Gardnerella on their penis after intimacy. Is it there in the next 5 days? I can't confidently tell you guys yes, but in other ways that men can actually impact BV for women is that we do know that semen temporarily raises vaginal pH. And I did make a TikTok a few months ago discussing how if you allow your partner, your sexual partner, to ejaculate inside of you all the time, this temporary rise of the pH and this high pH exposure over and over and over again to the vagina can over time kill off lactobacillus, which can increase your risk of Gardnerella. So it's fully plausible that constant semen exposure can actually disrupt the vaginal microbiome, make you lose lactobacillus, and then allow for Gardnerella to overgrow. So it's not a scenario of a man inserting Gardnerella in your vagina, because Gardnerella is native to the vagina. It's about creating an environment that favors Gardnerella, and semen can do that. So, and of course, microbial exchange happens during intercourse. So obviously the hygiene of the penis is very important. That can cause a shift in the vaginal microbiome. So these are just important things to remember. We can't say that men are the reason for BV, because it really does leave out a large population of women who are in lesbian relationships and women who are celibate. Like, it leaves them out. Women who are postmenopausal, who are like, I'm not having sex because I'm struggling with vaginal atrophy and things like that. Like, now you're telling me that it's because of sex when I'm not having sex. Like, I've had women reach out to me and say that, and studies document that. So we just have to be careful that we're not making it increasingly harder or putting a stigma on these conversations accidentally, even though we're all trying to get to the root of why BV keeps coming back. But I think men contribute in different ways. I think sex contributes, but I think sex can contribute through the use of a spermicide, right? I think it could contribute through the use of certain birth control methods or pregnancy methods. Some condoms contain spermicides on them, which can actually kill off lactobacillus, rise the vaginal pH, and allow for Gardnerella to thrive. So sex can influence the vagina, but I wouldn't necessarily just say men do. So next up, can anxiety alone cause vaginal symptoms? So the short answer is anxiety doesn't directly create bacteria, but it can change the environment, because chronic anxiety can elevate your cortisol, which is your stress hormone, and it can suppress immune signaling and reduce your IgA. It can cause hormonal shifts, and it can increase inflammation. And basically that cascade effect of all of these things being impacted through your anxiety can shift the vaginal ecosystem. And I also want to bring up that we're asking, can anxiety alone cause vaginal symptoms? I kind of touched on how anxiety can shift the vaginal microbiome and cause vaginal infections, which in turn can cause vaginal symptoms. But it doesn't always have to be vaginal infections that exist, right? So a lot of people don't talk about this, but separately, anxiety can cause pelvic floor tightening. And that pelvic floor tightening can contribute to vaginismus or pain or burning sensations, because there's tightness within the pelvic floor muscles, and that can cause nerve sensitivity to the nerves that exist around the vulvar region. And so you can have burning or stinging and think you have a yeast infection, but it's not really a yeast infection. So anxiety in two ways can either trick you into thinking you have an infection, or create a cascading effect that can create an environment in the vaginal microbiome that shifts and allow for a yeast infection, BV, or UTI to happen or take place. But anxiety is a factor, and many people don't talk about it. And I think too, many people don't talk about how the nervous system plays a role without causing an infection, just like mimicking an infection through pelvic floor tension. I did pelvic floor therapy, and I'm fully healed, thank God, but I talk about it all the time about how important pelvic floor therapy is, especially if you're someone with a history of recurrent infections, because after my years of recurrent urinary tract infections, I struggled with pelvic floor dysfunction, especially because I struggled with UTIs. So I would hold my urine because I was afraid of feeling that burning sensation. So I would squeeze it out, then hold, then squeeze it out and hold. And over time, I created some level of pelvic floor dysfunction, and I would feel a burning sensation while peeing, panic and spiral into, I have a UTI, but it wasn't really a UTI. So anxiety in the nervous system can really trick you through things like vaginismus and have you think that you have an infection without it actually being an infection. You might have sensitivity during intercourse and think, oh my God, this is a yeast infection, it burns, but it's not really a yeast infection. So that's just something to think about. Next question, love this. And I think it's probably because I recently did a video on the luteal phase. Someone asked, why do symptoms flare in the luteal phase? So it's really important to understand that after you ovulate, which is around the middle of your cycle, it could be day 14, 15, 16, 17. But the point is after you ovulate, there is a rise and a surge of progesterone. And progesterone changes immune modulation. It shifts vaginal glycogen, which is the polysaccharide that essentially feeds lactobacillus so that lactobacillus can thrive. It alters fluid composition, so your vaginal microbiome, or just your vagina cervical mucus, becomes thicker in consistency, and it affects gut motility. So in some women, this creates an increased susceptibility to imbalance in the vaginal microbiome. It creates heightened inflammatory sensitivity, and it causes mood shifts, especially in people who struggle with PMDD. So symptoms that resolve after your period starts, that highlights that progesterone is the issue, because once your period starts, progesterone starts to go back down. So again, after ovulation, it rises, you get your period, it dips. That right there is telling. If once your period starts and you feel relief, it's a sign that your progesterone is the issue. And that's really, I mean, there's nothing you shouldn't try to alter your progesterone, but be mindful of, okay, my progesterone is changing things within my body. How do I support my gut microbiome during this time where I am more likely to struggle with a urinary tract infection? How do I support my vaginal irritation during a time where progesterone is going to dry out my vaginal tissue and I'm going to have this irritation and it increases my risk of a yeast infection? You can use maybe a hyaluronic acid suppository or something of that nature. But identifying that progesterone is the issue, because you're asking why do symptoms flare in the luteal phase, it is because of how progesterone changes certain things within our body. And knowing that is important, because then you can add extra level support to your immune system, your gut, your vagina during that time. Question 6, if stress affects hormones, how does that actually trickle down to the vagina? So this is another cascading effect that we need to think about, because stress is equivalent to cortisol elevation. So cortisol is your stress hormone, and cortisol suppresses your reproductive hormone signaling when it is chronically elevated. So that means that estrogen and progesterone can shift, and immune signaling can then shift. So then lactobacillus stability ends up dipping, and then your pH shifts. And now the vaginal microbiome is less stable. So the vagina is, honestly, it's not separate from your brain. People talk about it in isolation, but it is not separate from your brain. It responds to systemic physiologies. So it's very, very, very common for stress to end up creating this like trickle down effect that shifts the vaginal microbiome, which is actually the thought process behind our probiotic formula with Harmony. We wanted a probiotic supplement that supports the vaginal microbiome, just like with Clarity. But what is causing you to lose the good bacteria in your vagina? If it's stress, you could take all the probiotics in the world that you want. But if you're not addressing your cortisol adaptation, your stress adaptation, it doesn't matter, because you're taking the probiotics just for your hormones to impact it and shift it. And so you want to support stress adaptation along with giving your vagina the good bacteria that it needs. Okay, next question. This one's like random, but super important to talk about. Is women's health political? So, short answer is yes. And it's frustrating because health shouldn't be political, but unfortunately, access, research funding, medical training, and policy are absolutely political. Without a doubt, anybody who tries to argue that women's health and women's medicine is not political has no idea what they're talking about. They don't know what they're talking about when there's no federal mandate for medically accurate sex education. Women's pain is often dismissed. Black women have worse outcomes, and reproductive autonomy is debated constantly in our political system. That's political. It's as simple as that. That's political. So biology, no, it's not political. But how society treats women's biology, yeah, 100%. It absolutely is. Next question is, what's the most harmful narrative women are taught about their bodies? I would say that we're taught like the whole odor, smell, and taste of the vagina, even discharge, pain. Actually, let's break this down. So we're taught that odor is shameful, right? A lot of people grow up thinking the vagina shouldn't have any scent. The vagina, first of all, you know what? Let's backtrack. What's the most harmful narrative women are taught about their bodies? That down there is the vagina. That's the vulva. Like, we go around in society and say, like, our vagina. That the vagina is the canal. We don't know anatomy because of how society has made us so ashamed of our bodies, and we haven't been able to talk about our bodies. So the vulva, it has folds. The groin is there, and then you have your labia majora and your labia minora, which are all skin folds. They are skin folds. They're skin folds that have sweat glands, that have moisture content, that have bacteria. Yes, it can have a musty smell. That's normal. You could go all day and have a musty smell. That's normal. You could have a tangy smell. That is normal. We have literally gotten to a place where we have made women believe that any odor is disgusting, shameful, filthy. If you are having a foul odor, that is something that you really need to look into, because a foul odor typically is coming from inside of the vulvar region, which is your vagina. And if there's foul odor coming from inside and coming from the vagina, it is a sign that the vaginal microbiome is imbalanced. But a foul odor doesn't typically exist on the vulva externally. A foul odor, if any at all, is coming from inside, which absolutely needs to be taken care of and treated with antibiotics. And that in itself is not something to be ashamed of. It happens to everyone. If you are having odor coming from inside and coming from the vagina, you need to double check on your vaginal microbiome and make sure that you don't have an infection, because leaving an infection untreated can have serious adverse health outcomes. So it's really important to get infections diagnosed and treated. But the vulva can smell musty. It can smell like sweat. That's normal. Like, it's normal if you go to a gym and it smells like sweat. That's normal. You just worked out. There's sweat glands, there's moisture, there's external bacteria. All of that is normal. We've been taught that discharge is an infection. The minute you see any colored discharge, it's an infection. That people ask me all the time, like, why do I have so much discharge? Like, it's okay. Discharge isn't bad. Maybe you're ovulating. Maybe your vaginal microbiome is balanced. Maybe discharge isn't just a bad thing. People see discharge, hear discharge, and think discharge is bad. There's secretory glands. Like, it's secreting different types of fluids. That's normal, especially throughout our monthly cycle. So it's normal. Pain, again, we've been told pain is normal. And period pain, for example, can be normal. This actually in my intro, period pain can be normal, but period pain that completely like makes you unable to move, that's not normal. Like, if it just completely stops you from being able to function. But people don't know how to advocate for themselves, because we live in a world where all pain is just dismissed, and mood shifts means that we're dramatic. Like, society has taught us that our bodies are inherently dirty or malfunctioning, and instead of us having cyclical physiology that is normal and being taught to us, and it being or having physicians and people in this space explaining to us that the microbiome fluctuates and that hormones change week to week, or sometimes even day to day, that would help us understand with our bodies better. But instead, it's been framed that our bodies are the problem. We are inherently dirty. We have inherently malfunctioning bodies, and it's about how little we're taught about our bodies, because women's bodies are not a problem. Again, it's about how little that we're taught. So I could go on for days on this question, but that's just my 2 cents on what I think the most harmful narratives we've been taught are. If you could redesign gynecological education, what would you change? So I would integrate microbiome science. I would integrate the gut to vagina to immune connections. I would integrate the nervous system physiology, how the nervous system impacts the vaginal microbiome, and the vagina, the vulvar region, the vestibule. Like, I would make sure to include how the nervous system impacts our reproductive organs. Hormone and brain interactions. I feel like that's often not talked about, not discussed. People do not understand that your hormones are connected to your brain, which is all of it is communication between your ovaries, your uterus, your vagina. They're all interconnected. So it's really important to understand that. Systems biology thinking, right? Like talking about the whole backbone of my business and my products is, right, I create these products for these different needs, but at its core, it's getting to the root cause of all of these different issues. So I would want systems thinking to be a thing where we talk about how the immune system impacts the vaginal microbiome and impacts your hormones. We talk about how stress impacts your gut, how stress impacts then your hormones, how the gut impacts your hormones, how your gut impacting your hormones can then impact your vaginal microbiome, how your gut being impacted by stress can impact your immune system. Like, you see how it's all connected. That is the level of systems biology thinking that I would want integrated into gynecological education, because right now urinary, vaginal, hormonal, and immune systems are often taught in silos. Like, they're taught as individuals. They are not linked together, but in real life, they're deeply connected. Next question says, how long does it usually take to see results, and why do you recommend 8 to 12 weeks? So I recommend 8 to 12 weeks because biology takes time. The vaginal epithelial turnover rate is around 28 days, and microbiome shifts require repeated colonization cycles. There's also the fact that hormone regulation adapts gradually and immune modulation is not instant. So because of all of these things, it's really important to give your body time, like give your gut time, give your vagina time, give your immune system time. And it's also important to discuss that most clinical trials evaluate probiotics and hormone supporting ingredients at 8 to 12 weeks for a reason. And that is because they understand the physiology that it takes time. There's epithelial cell turnover and all of the things we talk about, microbiome shifts, and repeated colonization cycles, hormone regulation. Like, they understand that these exist, which is why these clinical trials take the 3 months to then reassess, and they have these milestones throughout, but 3 months is kind of the gold standard of what they're assessing for. Now, could you feel changes sooner? Absolutely, yes. Like, you can absolutely feel changes sooner, but stable change usually requires at least 2 full menstrual cycles is kind of what I, for the most part, recommend. Next up says, can I take multiple with Morocco supplements together? Yes, yes, yes. Bundling is so important. Again, systems thinking. We want people to be able to take the products together. We designed the product selection in a way where the products are meant to complement each other. So the probiotics are microbiome foundation for your gut and your vagina. Gut Revival supports gut lining and gut lining health, and it's a great fiber matrix for your intestinal barrier. And we have our immune supporting supplement for immune modulation. So if someone has both like stress, hormonal, and urinary concerns, alternating with Harmony and Clarity is the best smart strategy, but also throwing in Gut Revival. If you're someone who struggles with UTIs, throwing in Gut Revival, throwing in our immune boosting supplement, like, it's all interconnected. And we actually have our prenatal and our Beyond Multi, our multivitamin, which can be stacked on. If you are someone who's breastfeeding or you are pregnant, I would say avoid with Harmony altogether. Double check with Gut Revival. Show your physician the ingredient list, as well as Thrive Immunity. Thrive Immunity is also not recommended, actually. So with Harmony, Thrive Immunity, do not take if you are breastfeeding or you are pregnant. Gut Revival, double check because there is licorice root in it, but it's a standardized amount. So for the most part, it's generally safe, but always double check. And with Clarity, it's generally safe, but double check with your provider. But ultimately, our products are designed, or our product layout has been designed so that you can group things together and take them together and bundle. Because again, it's not just, we're not like a one system approach, a one size fits all. We want you to be able to focus on all the systems that are being impacted. And last but not least, how has your view of medicine changed since becoming the founder of With Morocco? I would say that the further I get into my career, I respect medicine so deeply. And at the same time, I've seen how time constraints limit exploration. I've seen how antibiotics are over relied on. I've seen how systems thinking is underemphasized. And all of that's to say that medicine saves lives, but women do deserve preventative ecosystem based care too. So ultimately, what I view in medicine is that I don't believe in rejecting medicine. I deeply respect it. I think medicine saves lives. I just think that there needs to be improvements in the space. And I think, who would I be to not be critical of medicine? I always say we're a science first brand, and that'll always remain the truth for With Meraki Co. We believe in science here. We are never going to be anti-science. It's hard actually being a wellness brand in the wellness space, because so much of the wellness space rejects science and medicine. We don't do that With Meraki Co. We do not reject science and medicine. We pride ourselves on trusting the science, believing in the science, and wanting to make those improvements in medicine so that patients receive better outcomes. And so that'll always ground our work, and that'll become increasingly true as we grow and as we expand our product lineup and create more products for you guys, because we believe in science. We want to believe in science to give you guys real results, right? Not just trends. Like even when we released Gut Revival, people thought at first that it was a greens powder. It's not a greens powder. We don't believe in just creating trendy things just to like fit in. We want to give you real scientifically backed products so that you can get real results. Nothing makes my day more bright than when people reach out to me and they'll say, I've tried so many different supplements, took With Meraki Co. supplements, and this is the first time that I've seen real results. That is why we create With Meraki Co. That's our difference. We believe in science, but we also need to call out science and call out medicine when it's disproportionately affecting Black women and women of color, disproportionately affecting women's health. Like that needs to be called out. So I will always be loud and proud about calling out systems that aren't fair to women and women of color and lesbian women and all of these things. But I also will always believe in science and trust science. So I think there's room for two of these things to both exist. That was it, guys. That was the Q&A. It's so nice to be back. I'm so happy to be filming this. I cannot wait for you guys to watch this. Let me know what you guys want to see in the next episode. And also let me know what you think of this, if there's any comments or other questions you guys have down below. But I love you guys so much, and I cannot wait to see you in the next episode. Bye, guys.